have Dr. Ben Schwartz of Healent Health, which is a patient engagement platform that leverages RPM and RTM tools to improve outcomes and patient satisfaction. He is a fellowship-trained orthopedic surgeon with over 14 years of experience. He served numerous healthcare leadership roles on both a local and national level, with a focus on developing and implementing evidence-based, high-quality MSK care delivery pathways. In addition to his clinical work, Dr. Schwartz maintains a strong presence in healthcare technology and innovation as an advisor to early-stage digital health companies. So with that, go ahead and take it away.
All right, thank you for that introduction. Yes, I'm proud to present Healent Health. Healent's near and dear to me. It's the first company that really got me started in health tech. It's also the first time we're taking the wraps off the work that's been done and discussing the traction publicly. So just to frame the scope of the problem, more than 30% of Americans live with some form of chronic or severe pain. And as a country, we spend up to $650 billion a year treating chronic pain. And it's not just the medical treatments, but it's also through disability payments and time lost from work, which results in lost productivity, which also comes with a cost. And this last point, I think, is something that's important to realize, that we underestimate the problem of chronic pain, and that more people live with chronic pain than cancer, heart disease, and diabetes combined. So that's really the problem that Healent has tried to tackle. These are the typical pain treatment spectrum. So on the left-hand side, you have your conventional treatments. It starts with diagnosis. Your first-line treatments are non-invasive things like CBT, over-the-counter medications, anti-inflammatories, TENS units. Then you move up to the level 2 treatments, which are more invasive, like thermal procedures, neurolysis, opioids, and nerve blocks. And then the final point on the pathway is the most invasive. It's surgical intervention, whether that's spinal cord stimulators, drug pumps, or spine surgery, hip and knee replacement surgery. On the right-hand side are your alternative treatments, and there's a lot of those. Traditionally, we haven't put as much stock into those in healthcare, but now we're learning, particularly with more complicated patients, such as chronic pain patients, that there's a role for these treatments. And so Healent was really designed to be able to bridge the gap between the conventional and the alternative. Any specialty that deals with chronic pain can benefit from the Healent platform. That includes anesthesia pain management, orthopedic surgeons, primary care sports medicine doctors, physiatrists, and neurologists. So I think this slide is important, and it really speaks to the changing sort of care model that's coming, and the idea that providers are being squeezed. There's this shift away from fee-for-service. CMS has been very clear that they are bringing value-based care initiatives. Their goal is by 2030 to have all beneficiaries on some type of accountable care. Commercial payers are following suit. This past week, CMS released its fee schedule for 2024. There's another 3 to 4% cut in reimbursement through fee-for-service to physicians. So I think we have to start taking this seriously. We have to realize that the way that we deliver care is going to change, and we have to adapt to that. So if you look at this chart in the middle, about 67% of the Medicare treatment that we deliver is below what it costs us to deliver the treatment. So we lose money on about 67% of those patients. 16% you make money, and 17% you break even. But there's really this downward pressure on in-office services. There is this shift to the home, to remote care settings. And again, I think CMS has been pretty clear that this is the shift that they're going to support and what they expect in the future. And we have to be ready to adjust to that. This slide really sums up what Healent is all about. So on the left-hand side, you have the patient. On the right-hand side, you have the physician. And the goal is to connect the physician and the patient anytime, anywhere. So for patients, chronic pain is a very complex, multifactorial problem. We're providing them with the tools to be able to manage that, whether it's through mental health, tracking their nutrition, their vital signs through remote monitoring, how they're using their medications, supporting them in physical activities. That gets fed up into the cloud. And then on the physician side of things, it provides the ability to do real-time treatment protocol adjustments to make sure that patients are staying on the care pathway, to identify when they're falling off the care pathway and do that proactively and intervening before it's too late. And then really supporting that eventual shift to value-based care so that you can flip that switch as we start to see more of these value-based care initiatives take place. And then the Healent Cloud is processing all that data and via AI, keeping the doctor and the patient connected 24/7. And we'll talk about on a later slide how we're doing that without overburdening the process. And you might be thinking there's a lot of companies in the chronic pain MSK space, a lot of competitors, some of them very well known, Hinge Health, Amada, Sword Health, a lot of unicorns. What makes Healent different, and what we feel really makes us different, is the focus on the doctor-patient relationship. So it's not selling to benefits managers, self-insured employers, or payers. It's really focused on doctor and patient, how do we support that relationship? How do we support it outside of the office setting, which is a very limited interaction? And it's hard to sell into that space. And that's why a lot of companies have abandoned that approach or don't take that approach, because the barrier to entry is very high. But as I'll talk about in a minute, the amount of traction that Healent has gained, I think, speaks to the strength of the platform and the ability to connect doctors and patients. So that's kind of the x-axis here. The y-axis is what we're calling the platform capabilities. And so it's RPM and RTM are a part of that, but it's not the only thing that Healent does. It's a tool to leverage that connection between doctor and patient. A brief recap of our history in the making. So the company was founded in 2020. The original idea was to support patient optimization for hip and knee replacement surgeries. That's how I got involved as an orthopedic surgeon. We're targeting hospitals and health systems. COVID hits, hip and knee replacement surgeries aren't happening anymore. Hospitals and health systems are really going into survival mode. So that created this pathway in 2021 to pivot more towards chronic pain, to care in the home, and rehabilitation. And so Healent was able to successfully execute pilots to several sites, including the largest pain clinic in Arkansas. By the middle of last year, really feel like our product market fit had been validated, brought a CEO and CMO hired to accelerate sales and pain protocols. The CMO is a pain management doctor. The CEO has experience selling in healthcare. Closed the year with 8 new sites onboarded, representing over 20,000 patients under contract, raised a $750,000 seed round, and grew the team from 5 to 18. And this is important. We're very proud of this. No venture capital funding up to this point, with all the traction and validation that we've had, selling to a traditionally difficult place to sell, which is into doctor clinics, not really doing any specific marketing focus, just kind of word of mouth. And so we're proud of the progress that's been made based on that so far. And then the really big news in the first half of this year, brought a chief strategy officer on board, 11 new customers, and that includes one of the nation's largest physiatry practice, which is going to bring over 400,000 patients onto the Healent platform. So tremendous validation from our customers. So to summarize the traction that's been made, the early results, the wins, up to 150 contracted providers on the platform. They're bringing over 500,000 patients onto Healent, 95% billing qualification rate. 85% of patients are retained on the platform over a 90-day period, which we're very proud of. It speaks to the strength of the platform and the amount of engagement that we're getting. This is a very high number for a digital health product. 75% reduction or improvement in Oswestry disability index scores, and then 56% of patients on the platform are reporting a reduction in pain scores. And on the right-hand side here is a map of all the sites across the country that are onboarding with Healent. And so it's West Coast, Pacific Northwest, Northeast, Midwest, and Southern United States. So again, all this has been done bootstrapped, angel funding, word of mouth, and into doctors' offices. Breaking down the customers, so left-hand side is the smaller practices, the right-hand side is the larger practices. And again, proud to announce in the first half of this year, signed an agreement with one of the largest physiatry groups in the country that it's going to bring over 400,000 patients onto the Healent platform. So when you're selling to physicians, what makes it difficult is you can't disrupt workflow, you can't overburden the staff, and you can't come at physicians with too much data at once. All 3 of those things are the barriers. And if any of those things are true, then you're going to have a hard time driving adoption. So what we built is a mobile app on iOS and Android that really engages patients. You see that with 85% retention. We have on-site care coordinators and success managers to make sure that that onboarding process goes smoothly, that you're not disrupting workflow, that you're not overburdening the staff. And SaaS is very popular because it's easy to scale. I think in healthcare, we know that SaaS alone is usually not enough, that you need the human element. And I think that's a big part of success that we've had, is having on-site success managers to smooth that process, a robust analytics dashboard with real-time patient information, and then the ability to partner with any FDA-approved device that through a Bluetooth or a Wi-Fi connection. It's device agnostic.
30 seconds.
This slide, I think, breaks it down importantly. So we're collecting all this data. It goes through an AI engine, and this is where the key thing happens. It's automated process. So we're not overburdening the patient, the clinical staff, or the physician. Using these different AI engines, we're able to take in that information, but not disrupt workflow, not overburden people with too much information coming at them at once, but really surface things as they need to be surfaced, or modifying the protocols as you go along, and really automating the process. And that's the key piece of why we've been able to get adoption, is we're not overburdening the staff with all this information. It's automated through artificial intelligence. And then finally, just to wrap it up, against a device agnostic partner approach, no specific device, the patient doesn't necessarily have to stand in front of a tablet and wave their arms around. Any of these devices we can collect data from. So to summarize, the goal of Healent is really to facilitate that 24/7 doctor-patient connection, but do so in such a way that's not overburdening, engaging patients, surfacing information, automating the process, and using technology in a smart way in order to provide patient-centric care and really help people adapt to the changing healthcare landscape. The team,
Great.
Anup Badge is the founder and CEO, and Mike Blackdehary is the Chief Strategy Officer, and that's their contact information. So thank you for your time.
Fantastic. Great presentation, Ben. Thank you so much. We have a couple minutes for questions if the judges have any. We'll probably just take two quick ones.
I can start. You mentioned 36 million MRB. I think this is a new term, at least for me. What is MRB? And like of this 36 million MRB, what is your current revenue essentially?
So the MRB is the monthly billing based on the RPM and RTM codes, and I defer to the team for specifics on that. So happy to get you in contact with them in terms of current revenue, but that's what that is. It's the monthly billing.
So it's about like what percentage of a bill is your revenue approximately?
I'm sorry, say that again.
What percentage of a of a bill would be your revenue usually?
Yeah, I'd have to, I don't know if I'm at liberty to disclose that. I would defer to the team in terms, but it's a model of taking that percentage of the billing, and the practice gets a certain percent, and Healent provides a service and gets a certain percent as well.
Okay, thanks.